Right, I reckon, Mike, John, you should start your
Okay.
preamble. I think because it's what are we, 3:32?
Yeah.
Let's go. What's up here?
Yeah. Okay. Well,
You're going to turn your microphone on, John.
Back on. So good afternoon, everyone, and thank you for joining us today. It's a very important topic. What I first of all want to say is thank you and all of your teams for the valiant work you continue to do and the excellent efforts of the team to care for those related to our services. We continue to really do amazingly well through the pandemic. Those of you to be aware is if we look beyond today and look forwards, the vaccine is very much a key part of our staying healthy, looking after the people we care for, and ensuring we're all safe and well moving forward. We're very much, as you hopefully know, in the middle of our vaccination fortnight, where we're trying to promote kind of best practice and reassure people and answer questions. Today's session is being recorded, so those of you that have people who couldn't make this session, they'll be able to look at this later on, and we'll make it available to people. We have opened the chat line if people want to ask some questions, but there'll be an opportunity after the session as well, so bear with us. So in terms of a little bit of information, as I look at the DRA, I can see that we've got 5,426 members of staff that have been vaccinated. There's still some way to go, but it is ramping up very nicely. And we're getting quite close to 2,000 service users that we care for having been vaccinated. So first dose. So we've made good progress, but what we want to try and do is make everyone aware of the benefits of the vaccine and actually why it's important to consider having the vaccine. So as part of that program, I'm really pleased that we have connected today with GPDQ. GPDQ are an organization that we're doing some strategic work with, but I'm really pleased to say that they are very much aligned with the NHS. They're a primary care organization, multidisciplinary. They all work within the NHS, but also provide private GP and other services. They actually support over 2 million patients. So they're one of the largest clusters of GP groups that I'm aware of. And we've been very impressed by our joint work with them at the very early stages. So today, we're fortunate to have 2 people from their organization who are experts in this field to come and talk to us, answer any questions and handle the Q&A with us. So I'll hand you over to Dr. Katrina and Lucas, who will take you through the session. Guys, do you want to do a bit of a brief intro to yourselves?
Yeah, thank you very much for that. So I'm Dr. Katrina Christalis. I'm an NHS GP, and I work in North London, Northwest London, and live in Northwest London. And I also am one of the clinical directors at GPDQ. So as we said, GPDQ works with the NHS and supports the NHS, but it's a private entity. And in the last year, my role both within the NHS and within GPDQ has been very much helping to fight this battle against coronavirus in many different ways, dealing with patients that are well and their normal ailments that they would have had, and also dealing with patients who have got COVID, etc., and advising them, and most recently helping with the vaccination efforts. So being delighted to help answer any questions, and we've prepared some questions already that have been sent in, so I'll be helping with those questions today.
I'm just going to ask everyone to mute themselves because we can see backgrounds.
Who is that?
Lucas, I hand over to you to give yourself an introduction.
Yeah, thank you. Sorry, I was just checking whose background I can see so I can mute. Hi all. My name is Lucas Ski. and I look after corporate health and well-being. And what it actually means is that I advise businesses on how to look after their staff. But on top of that, and obviously help them reduce absenteeism, presenteeism, and be proactive about their health and their well-being. On top of that, I also run an Ask the Doctor channel with Dr. Katrina Kristalis. So there's a lot of health-related content that we share on LinkedIn, and there's also a channel that we run. If you really wanted to meet me, I am basically, you can find me in the Essex Riviera, swimming in the sunny shores, no matter the weather. So that's just a quick introduction. But what we obviously here today is to talk about the vaccine experience, the vaccine in general. Now, to start with, what I wanted to mention is GPDQ Experience, as we are sort of dealing with the unprecedented times. So for the last 18 months, what value we have been adding to both sectors, the public sector and the private sector. So what is certainly worth mentioning that we have been enabling the city councils in Midlands with administering thousands of tests, so helping NHS and helping the country battle the virus and make sure that it's well contained. We've been also looking after the local outbreaks and providing the individuals with PCR tests. The other expertise that we have provided and added value is for all those individuals that were at home and weren't sure whether they need to be hospitalized. So we were able to send the doctor to their home and advise the individual, and obviously clinical panels to see whether they need to actually go to the hospital. And in the private sector, so the sector that I am typically sort of involved in is enabling employers to have access to tests so their staff feel secure and can still go to work. That's pretty much kind of summarizes it. But we also are able to help with the PCR test by just like, all the drive-throughs that you have seen that via the NHS. If there is a need to go through the private route, then we also have a very similar drive-through on one of the sides. And obviously, I have mentioned about the on-site testing. So that's one of the things, that's how we have been helping and adding additional value to dealing with what we are currently dealing with. So yeah, once again, what we will be focusing around today is the COVID vaccine, and particularly the question and answers. So there will be questions that we know from just the experience that are being asked, that we have been asked by individuals. There are some questions that I think Jeremy and John have found and asked the team, so we will cover them as well. And then we obviously, as promised, spend some time right at the end to see whether we could answer any of your questions at some point later. It will be quite an interactive session between me and Dr. Katrina. So I will be asking her some of the questions that were asked, and then Dr. Katrina will be able to elaborate and tell us a little bit more detail around them. So Dr. Katrina, we know each other quite well. Hello. Thank you again for providing your knowledge and equipping us with all that confidence that we all sometimes need. So first question, why should I get the vaccine?
Thanks, Lucas. So I think this is a good question just to start on as a general introduction. Vaccine is hugely important. Vaccines teach your immune system essentially how to protect you from a disease. So before you get a disease, it's much better for your body to learn about that disease and learn how to fight it through a vaccine, just on the most basics of levels. And I think that the first place to start should actually be with some success stories. So in the past, we can think of two of many examples of where vaccines have been super helpful. One is smallpox. So smallpox has now been completely eradicated, and it was actually once a common disease that killed a third of people who were infected with it. So that's a huge success story of where vaccines have been used. Another one is polio, which is now a very, very rare disease. polio is something that when you contract it, it in the most part is asymptomatic, so you don't know that you have it. But in some very rare cases, it can cause paralysis. So this is another example where vaccinations have been used successfully, and they've helped to eradicate in case of smallpox and also eradicate the polio. Thanks, Lucas. So the next question. So the next question, in terms of why should I in particular get the vaccine? This is so that was the first question, was kind of an introduction to why vaccines are useful, but why everybody individually should get the vaccine, and especially if you're fit and well, why do you need the vaccine? So I suppose the counterpart to that question is that the majority of people, and we know this from the media, we know this from the news, the majority of people who are unwell with COVID-19, they're people who've had comorbidities, they're people perhaps that are overweight, that have diabetes, high blood pressure, etc. So if you're young and you're fit and well, why do you need the vaccine? So there's a number of reasons. Firstly, to protect yourself still, because even if you are young and you're fit and well, there still is the possibility that you can contract COVID-19. And so firstly, you want to protect yourself. And strangely, people who are young, fit and well, who develop mild cases of COVID-19, there's actually been incidences, and it's fairly, I'm not going to say fairly common, but there's been a large proportion of mild cases that have gone on to experience long COVID. So long COVID is when you have symptoms of COVID-19 that go over 4 weeks. So it's actually been disproportionately seen in some of the milder cases rather than the strong cases. So you need the vaccine, firstly, to protect yourself, and then secondly, to protect the loved ones, your colleagues and those that you care for. So if you are young and fit and well, most likely, if you do get it, you'll be asymptomatic. And the government says at the moment that roughly 1 in 3 people who have COVID-19 are asymptomatic. So by having that disease in an asymptomatic manner, you may unknowingly be passing it to your loved ones or to your colleagues or to those that you care for. So you want to have the vaccine to protect yourself, as we said, to protect those around you, and then on a societal level. So we know that the more people that have the vaccine, the better it is for society, and the quicker we can get out of this lockdown. And then next, in terms of specifically BAME communities, why they would need the vaccine. So we know, and this is, this has been such sad news this year with relation to coronavirus, that sadly this community has been disproportionately affected by COVID-19. And I'm going to be using information quoted from the JCVI, and that's the Joint Committee on Vaccination and Immunisation. So the JCVI, they advise the UK health departments on immunisation, and I'll be using information from them quite a lot. So they've stated, and it's what we've heard on the news, that there is evidence that that the BAME community has a higher rate of infection, higher rate of serious disease, and a higher rate of morbidity and mortality due to COVID-19. So we know that there's a huge problem there, and we want to protect the BAME community obviously as much as we can, and the way in which we have is through the vaccine. So there have been no contraindications for the BAME community or other ethnic groups to have the vaccine. And I've done some research from the public assessment reports. Now they kind of contain the information about the trials and information on the trial participants. So the Pfizer vaccine, participants included 6.9% Black African, 26.1% was Hispanic or Latino, and 3.4% was Asian. And in the Oxford vaccine, the AstraZeneca one, which is also being used, 10.1% of trial recipients were Black and 3.5% were Asian. And it's been documented that there's no evidence that either vaccine will work differently in different ethnic groups, and they're safe for all ethnic groups. Okay, thank you, Lucas.
Yeah, and then the vaccine and my health. So I guess it's worth certainly adding on that there have been people that had the symptoms for longer, which is now obviously known as long COVID. So do I still need to get the vaccine if I had if I have been diagnosed in fact with long COVID?
Thanks, Lucas. So yes, absolutely you do. So just to give you some definitions to help put it into context. So an acute COVID illness is defined as having had the infection in the first 4 weeks. Typically, the course of an infection will be that it will kind of maybe last 1 or 2 weeks, but occasionally it goes up to 4 weeks. Long COVID is defined as the illness exceeding 4 weeks, and in cases it's lasted for months. And this has actually been the cases of long COVID have been so many that the government has actually created long COVID clinics. I think there's been between 40 and 60 long COVID clinics created already, and they're for people that are continuing to experience symptoms way past the 4-week period, actually past 12 weeks in some cases. So do you still need to have the vaccine when you're experiencing symptoms, kind of ongoing symptoms from your infection from COVID? And the answer is yes. So if you're having an acute COVID infection, so that's within the first 28 days, the first 4 weeks, you wouldn't have the vaccine, but you can have the vaccine any day after 28 days from either your first symptoms or your positive test. So that's a yes to that question, Lucas.
Thank you, thank you. And for all those that have been infected with COVID, should they still get the vaccine?
Thank you. So, and again, another really good question. It's also a very common question. I've been asked this on a number of occasions. If you've had COVID-19, what we've been told and what would make common sense is that you develop, if you have an illness, you develop immunity to it. So then I can see why the question is raised as if you've got immunity, why would you then need to get vaccinated? The answer is yes, you do. And the reason is because if you have an infection with COVID-19, there's limited knowledge about the antibodies that you would produce. So some people may not produce antibodies after a COVID-19 infection, and other people who do produce the antibodies. So the antibodies are what your body uses to fight the infection if it were to be presented with it again. If you get it again, there's no evidence of how long your antibodies last. So it might be that after 3 or 4 months, you no longer have antibodies, you no longer have immunity to COVID after an initial infection with COVID-19. And there are cases of people who have had COVID more than once. And what that shows is their antibodies were not sufficient, or they didn't have any antibodies at the time they were reinfected to prevent them having another infection. So if you've had COVID-19, yes, you do still need the vaccine to help you fight against a future infection. Thanks, Lucas.
Thank you. And then with regards to allergy, so that's one of the questions that I have asked myself when I had my vaccine. How can they affect you if you're getting a vaccine?
Definitely. And again, another very common question, and quite rightly so, because we want to be delivering vaccines, but obviously in a very safe manner. So essentially, with vaccines, anybody who's had a history of anaphylaxis to any component of the vaccine, they shouldn't receive it. And anybody who's had anaphylaxis to the first dose of the vaccine, they should not receive their second. Now, obviously, that leaves an area of grey because, you know, there's other forms of allergy as well. It's not just anaphylaxis. And in these instances, I think that the best thing to do would either be to discuss with your GP if you have other questions, or to discuss when you go for your vaccine, you'll have a consultation before your vaccine is delivered with a clinician to raise your concerns then. But in general, anyone who's had anaphylaxis to any of the components. Now, one of the main components which is present in the Pfizer vaccine and the Moderna vaccine, but not the Oxford vaccine, is something called PEG, P-E-G, which stands for polyethylene glycol. Now, that is present in, as I said, Pfizer and Moderna, And some people may have a history of anaphylaxis to this ingredient. If that is the case, you can't have the Pfizer or Moderna vaccine, but you would be eligible for the Oxford AstraZeneca vaccine. So again, these are just things that would come up if you discuss it with your GP or with the clinician that you're seeing before you have your vaccine. But what we've also done is include the links to the 3 vaccines here. Obviously, Pfizer and AstraZeneca are available at the moment. Moderna, we're told, is to come in the future. So if you are worried about the ingredients, or if you may be allergic to the ingredients, have a look, and these links show you the exact ingredients within the vaccines.
Thank you. And I guess another question that I have had myself quite a lot throughout the sort of my own community and friends and family, can you have a vaccine if an individual is pregnant or trying to get pregnant or is currently breastfeeding?
Thanks, Lucas. So yeah, I think this is another very common question, and as a relatively young female GP, it's one that I've been asked a number of times, and I can understand the anxiety around this, around pregnancy and ladies trying to conceive as well. So the advice that we have at the moment is that during pregnancy, you should not have the vaccine. That's the general advice if you're pregnant. There are 2 subcategories to that. So if you are pregnant but you have a high risk of contracting the vaccine, COVID-19 because of your work, if you have a lot of contact with COVID, that may be an exception. Or if you are somebody who would be extremely vulnerable to COVID-19 and you're pregnant, that would be another possible exception. But on those 2 incidences, that there would be essentially a discussion to be had with your doctor to assess the risk and benefit that is individual to you in that circumstance. So generally, if you're pregnant, no, you shouldn't have the vaccine, but those are the 2 points at which a further conversation would be needed. The second point of this question is if you're trying to conceive. So the committee that I mentioned before, the Joint Committee on Vaccination and Immunisation, the JCVI, that advises the government, they have said that they do not advise routine pregnancy testing before your vaccine, and those who are trying to become pregnant do not need to avoid pregnancy after vaccination. So I think that's quite clear to that group. Now, to those mothers who are feeding their infants, the same committee, the JCVI, have said that there's no known risk in giving the vaccines to ladies who are feeding their infants. So I think that answers all your 3 points there, and they're quite important points. And the second question, sorry, Lucas, I'll just go on to it myself. This is a question that I think a lot of women are worried about. It's a question that says, I've heard that the COVID vaccine can affect your chances of getting pregnant or cause infertility. Now, this, and I'll come on to misinformation on another question later in the slide, but this question basically focuses on some misinformation that was given kind of previously from a previous employee of Pfizer who suggested or raised the concern that there might be some links with the vaccine and infertility in women. Now, obviously, that's hugely alarming to any woman who's thinking of becoming pregnant. And actually, I have to say I've got a personal story in this. So even as a GP who's obviously looking and reading many things about the vaccine, I had, and this is an example of how misinformation can kind of spread quite easily, even when it's not meant to cause harm. So I'm a GP, I've got a friend who's a midwife, and that friend heard of her consultant who's an obstetrician. This is many months ago when the vaccine was just being introduced. So as healthcare workers, we got as doctors, we got the vaccine slightly earlier. And the consultant had said, you shouldn't have the vaccine because it can cause infertility. My friend who's the midwife had told me. And as a female, I also was thinking, is this something that, is there any truth to this? And at the time, there was no official response from the Royal College of Obstetrics and Gynecology or the Royal College of Midwifery, and this rumour was just out there without an official response. It was something to do with the amino acid sequence of it. Anyway, since then, I have had my vaccines, both of them actually, but there is an official response now, and I've put this link there because I know also as a young female GP, a lot of kind of friends and patients or colleagues have come to me informally asking about this question, saying, does it have an effect on infertility? And this is the official response. And if you have got concerns yourself, click on the link, follow it through. From the Royal College of Obstetrics and Gynecology and Midwifery, a joint statement saying that no, it doesn't. And actually it was misinformation that was leaked. So there is no association between the vaccine and infertility in the future. So have a look on that. And there's another separate link through that link about questions and answers that from the Royal College that is available to you there.
And that brings us to a bit of more information on what available vaccines we currently have in the UK.
Yeah, thanks, Lucas. So I think most people will be aware there are 2 vaccines at the moment that have been made available. One is the Pfizer vaccine and the other is the Oxford AstraZeneca vaccine. And they've both been approved, both been deemed safe and effective. And the question is, what is the difference between the 2 vaccines? So the Pfizer vaccine is a nucleic acid vaccine. And what that means essentially, and I don't think it's hugely important to know exactly how they work, but they do work differently. So both vaccines, what the aim is to introduce the vaccine into your system so that if your body is exposed to COVID in the future, it's had some exposure, the body understands how to fight it and the body knows how to fight. So the Pfizer vaccine works through something called mRNA, which is essentially a type of code or instruction. And that instruction basically it enters the body and the body recognizes it as as abnormal, and then creates a defense system in the immunity so that if the body is faced with the COVID-19 in the future, it knows how to fight it. The next point is the Oxford AstraZeneca one, and this is made from a modified virus that causes the common cold in chimpanzees. And again, if this enters your body, causes your body to recognize it as abnormal, the body creates a defense system, and then it uses it in the future if it's faced with COVID-19. So both are just essentially training your body to know what to do if it's faced with COVID in the future.
Thank you. And now there are obviously more questions around the available vaccines and what actually vaccine contains.
Thanks, Lucas. So there was a link on a previous slide which has the exact links, the exact ingredients to the vaccines. None of the ingredients, none of the vaccines approved in the UK contain live vaccine. And so, yeah, just have a look at the ingredients if you're concerned about what they contain, but none of them contain any live virus in them.
And that is certainly not COVID-19, yeah?
No, so some people have wondered that if you have the vaccine, can you catch COVID from it? And absolutely not. The vaccines just prepare your body for a potential meeting with COVID-19 and what to do, but they do not contain any live virus in them. So any of the vaccines.
So on that note, I mean, that obviously is a question too, but how does the vaccine work? Can you give us a little bit more information on that note?
Essentially, it just trains. So both vaccines work in different ways, and they both train the body for if there is a presentation of the virus, the body has a defense system, and they work in different ways. So the first one, as I said, is the nucleic acid vaccine, the mRNA. The body receives a piece of code, the mRNA, and that is abnormal, and the body develops its defense. And the other one is it receives a piece of modified adenovirus, which causes the common cold, and it's modified to replicate something similar to COVID-19, so the body knows what to do in the future. So they're just training your body essentially.
Thank you. Yeah, and we've obviously answered the number 2. And yeah, now we are moving on to those questions that we had from you guys and the team. So we wanted to obviously be a bit more personal. The other questions were sort of the general one that we were receiving and the common one that you can kind of see almost everywhere. So with regards to the first question that we have received from you guys, tell me about the actual injection and what happens and how long does it take?
Thanks, Lucas. So essentially, the whole process of the vaccine should take no longer than 20 or 30 minutes. You arrive at the vaccination center, you're shown to your booth, and in the booth, you'll be there there'll be a clinician and possibly an administration member of staff. The clinician will take your details, your name, etc., and then they'll have a brief discussion with you where they discuss your allergies. So if you have any questions about that, that's the time as well to bring them up. And they'll also get your consent for the vaccine, so they'll have to talk it through with you. So that period might last 5 minutes or so. You have your vaccine, and the actual vaccine is just a needle into the arm, and that part takes 15-30 seconds, no longer. It's very, very quick. Following the vaccination, you will be asked to remain there for about 15 minutes for observation, because if you are to develop any sort of allergy or response to it, any reaction, it would happen in the first kind of 5, 10, 15 minutes. So that's why you're asked to remain there, just to be observed. But actually, the whole process is relatively quick and smooth.
Yeah, thank you. And that was pretty much my experience. And the question number 2 on that page was the first one that I have asked as well. So how long till the vaccine becomes effective?
Thanks, Lucas. So you do need 2 doses for the vaccine to be fully effective and to have the best long-term protection. But you'll start to have a fairly significant protection from 22 days after your first dose. It is worth mentioning, I don't think we've covered it as another question, but after you receive your vaccine, even as it is so effective, the guidance at the moment is that you still need to socially distance, wear a mask, wash your hands, and all the things that are in place at the moment to prevent you spreading it on, because there isn't any knowledge at the moment that if you don't get it, you can still spread it on to others. So you would, the information is that you'll have a significant protection at day 22, but you still should follow the government advice on taking those other precautions.
Yeah, really useful. And is the second dose really needed?
Yeah, so absolutely. As I said in the response to the other question, trials have shown that the vaccine is more effective if you have 2 vaccination doses. And that's to increase the effectiveness and increase the long-term protection, so to extend the time that you're protected for. At the moment, there is some discussion, and I think people might have seen it in the news, about trials going on of varying the different vaccinations that you get, of having different vaccinations the first and the second time. But at this present point in time, the guidance is for 2 of the same vaccine for your first and your second vaccination.
Thank you. And what sort of common side effects or unwanted effects are actually seen out there? Thanks,
Lucas. So for those of you that have had a flu jab, it might be slightly similar to your experience of the flu jab. I think a very common side effect is to have a sore or painful arm at the injection site, just a bit of tenderness around there. Other fairly common side effects have been headache or aching, kind of flu-like symptoms, possibly a fever, and just not feeling so well in yourself. It should be noted, though, that your side effects should not last more than 48 hours. And I've also been asked how to differentiate between, for example, COVID-19 and side effects, because obviously just the point that you're getting side effects would be 1 or 2 days after you've had the injection, the vaccination. So you wouldn't be vaccinated then. And you might still be, if you have a fever, it could still be a presentation of COVID. So the current advice on side effects is if your fever exceeds 48 hours, or obviously if you have any cough or change to your sense of smell or taste, those two are not common side effects from the vaccine. So if you have any additional symptoms like that, then you should speak to a doctor, etc., to differentiate between the two. But essentially, those are the main ones. From my personal experience, my first vaccine, I didn't have any side effects. I had the Pfizer one, and my second vaccine, I did actually have a little bit of a fever and body ache, but that lasted for about 12, maybe 24 hours, and then it was done. I took some paracetamol, and it was over. And in my family, my parents have had the Oxford vaccine, and they didn't experience any side effects.
Yep. Thank you so much. And another question that came, and I'm sure my wife would have asked that, is the vaccine vegan, vegetarian friendly?
Thanks, Lucas. So yeah, both vaccinations contain no animal products. So both of them are vegan, vegetarian friendly.
Thank you. Then some more questions on the other side. When can we expect for everyone to be vaccinated, and will children get the vaccine as well?
Thanks, Lucas. So government have said, and you might have heard it in the news, they aim for all adults to be offered their first dose of the vaccination by the end of July, and to receive both doses by August, which is hugely exciting if you think of the position that we'll be in then with a vaccinated community. And at present, children are not being offered the vaccine, but there are some trials looking into vaccinations in children, but it's not something at the moment that is offered.
Thank you. And there are some links here where what sort of thing we can get on social media and in the press about the vaccine, and who do we trust? Would you like to say anything sort of as an add-on to those links that we shared here?
I think so. As I explained, I mean, misinformation, nobody is immune to misinformation. As I explained in my own experience, you know, that was a midwife and another doctor who had unwillingly passed misinformation on, and that what they were trying to do was the right thing to you know, to protect their friend from having harm. Now, I think this has been an unprecedented year. It's been, you know, there's nothing normal about what's gone on in the last year, and we're asking a lot of everyone. You know, we're asking parents to become healthcare professionals and swab their kids. We're asking HR to suddenly become doctors. We're asking everyone to extend their role beyond what is normal. And, you know, the public have to be commended in how they have responded to this. And one of the things that they've done is obviously look for more information. Now, one place that's easy to find the information is on social media, or to ask a friend, you know, and people don't, in the majority of cases, aim to pass misinformation, but it is out there. So I think if you are wanting more, you know, more information, which is quite right, it's a strange situation, and especially, you know, this vaccine, it's being produced quickly, people are worried about that. If you do have questions that haven't been answered today, we've tried to put on quite a few official links. So go to the official places first, go to the NHS, to the government advice, and that's where you'll find the answers with science behind them, and that's what you really want, information that's been gathered, you know, and been reviewed, etc. So these are some links that we've put down as a very good place to start for any questions that you might have at official kind of sources.
Thank you. That's just a page that basically confirms that we are using the official guidance and suggestion, which Dr. Katrina have just mentioned. And I think I'll pass on to John here.
Sure, thank you, Lucas. I guess Lucas and Jeremy, is there anything that's come in via chat that we haven't covered that you think we might want to maybe pick one or two of those questions? Obviously, we don't need to, this isn't the only forum, because you can raise your questions after this on the usual COVID-19 site, but I just wondered if there's anything, Jeremy or Lucas, that you can see that would maybe be worth discussing with Katrina now, or?
Yes. Jeremy, unless you can see something that you would want it to take out of the...
The question I think that comes up is we hear about new variants all the time, Dr. Katrina. Can we make any extrapolation about the efficacy of these vaccines against these new variants? Where do you think we are with those?
So I think different sources will, it's difficult. I think what we're being told at the moment is that the vaccines are effective against these new strains. The Brazilian strain, we don't know because it's new. I don't think there's any information on that at the moment. But the other strains, the vaccines are effective against them to varying degrees. But in any situation, you're in a better situation if you've had your vaccine. And I know that the vaccines are, scientists are looking into amending the vaccine, so possibly in a further dose, it would be slightly tweaked vaccine so that it provides cover for these new variants.
Okay, thank you. I've got another one here, Lucas, if you don't mind, which is if I can still catch COVID and pass it on if I have the vaccine, why do I need the vaccine?
So that's a really good question. It's not known if you can still pass it on if you have the vaccine. That's what we're being advised at the moment. Sorry, I've worded that wrong. We're being advised to act as if you can still pass it on if you've had the vaccine, so that we don't pass it on unwillingly or unknowingly. Most likely, it's going to be that if you have the vaccine, it will drastically reduce the transmissibility, the ease at which you can transfer it to somebody else. But there isn't enough information. So the government are leaning on the safer side, so with caution, to say that we don't know yet. Not that you can transmit it if you've had the vaccine, but we don't have enough information. So for that reason, you should still wash your hands, socially distance, etc. But most likely, in my opinion anyway, and this is my opinion, most likely, and I think that in some of the trials that have gone on, it's been shown, but there isn't enough sufficient evidence for it to be official advice at the moment. We will find that having the vaccine does help prevent it, and stop the chain between yourself and a loved one, for example.
Okay, I think that was probably the main ones.